Good evening. I am Priya David Clemens, the host of KQED Newsroom. I am thrilled to welcome you here to the 18th Annual Hearts in SF. I'm coming to you live from Oracle Park, reigniting our long-standing tradition of gathering together here on the ball field for Hearts in SF. And while we can't all gather physically just yet, I can feel your spirits here with us tonight. So get comfortable and get ready for an evening of inspiration and hope. Tonight is an opportunity to show our support like never before for the incredible teams caring for our community at Zuckerberg San Francisco General Hospital and Trauma Center. This has truly been the most difficult healthcare environment of our lifetimes. And through it all, these remarkable teams have strategized and adapted to every single twist and turn. In the midst of this global pandemic, healthcare happens at ZSFG. And you are a vital part of that. As you can see to the right of the screen, you'll find a donate button, a chance to show your support throughout this evening's program. And we want to see how you're choosing to celebrate Hearts in SF from home this year. So take a selfie or an USSY and share it on your favorite social media channels with the hashtag HeartsInSF. Let's celebrate together online. Now let's take a moment to thank our community leaders who made tonight possible. Enlight Foundation, Bank of America, UCSF at ZSFG, Stephen and Diana Strandberg, BMO Financial Group, the Stanley S. Langendorf Foundation, and Elizabeth Osterman and John Riccitello. Joining us now is Kim Meredith, the CEO of San Francisco General Hospital Foundation. Kim, thank you for hosting us all this evening.
Thank you, Priya. I am so excited to be here this evening, and welcome to all of you. Hello, I'm Kim Meredith, and I'm CEO of the San Francisco General Hospital Foundation. And our mission is to fund and support patient care and innovation at ZSFG because we believe in health equity and access to care for all. So this past year has been quite a year for all of us. And during good times, ZSFG takes care of 20% of San Franciscans. And during this pandemic, it has been up to 30% of our community. What does that mean? So in our acute care hospital, that's about 90 to 100,000 visits per year. And in our outpatient care, that's 500 to 600,000 visits per year. And 10,000 of those visits are for pediatric care. So we are absolutely this incredible, important underpinning for the community. So I want to thank you all for your support. And looking back, it was back in 1993 that the foundation was started. So we have been around almost 30 years. And the underpinnings of that formation was that we would come together to support patient care and the needs of the healthcare providers at Zuckerberg San Francisco General Hospital. And we have built on these values between the two organizations, the foundation and the general, based on equity, compassion, and care. And that's our vision, that everyone deserves access to exceptional health care. So here we are, fast forward, it's 2022, and we are celebrating our 18th anniversary of Hearts in SF. And this event was started, Hearts in San Francisco, with the sculptures as the original attraction. So look where we are today, 500 sculptures later, $32 million later, just from this event and the sculptures. So the relationships and the community support that it has created has really been extraordinary, and that's because of all of you. So this year, we come together, and the art is just extraordinary. It's about being interconnected and storytelling. And those themes and designs come through in the sculptures, but will come through all evening as we celebrate our heroes and all of the elements of our evening together. So thank you for joining us, and I know it will be a compelling and heartfelt evening. Back to you, Priya.
Kim, thank you for laying out the mission of ZSFG and why we're all gathered together tonight. The complexities of the past 2 years have highlighted the heroism of the hospital's dynamic team. So let's kick off our celebrations this evening by honoring our first group of unsung heroes at ZSFG, the environmental services team and the facilities team.
Environmental services is dedicated to provide clean and sanitized areas for the entire hospital. Ever since the pandemic started, our department was able to immediately switch gears and start providing the support that doctors and nurses needed for them to take care of our patients. They truly go above and beyond. They are my heroes, like Sarah.
I'm the 1406 senior clerk with San Francisco General. I work very closely with the management team, also supporting the staff who are responsible for keeping the hospital clean. People maybe don't notice how big of a role that the porters play, but they are the ones that are making sure that the space is going to be good for the next person to come in and use. They're really an integral part of the healthcare system here, and they have a direct impact on the patients that we service here at the hospital.
We are proud and grateful for their remarkable resiliency in dealing with difficult conditions and determination to be part of the team that works, making a difference for our community, for our doctors and our staff.
Facility services is an essential player at the hospital. We take care of it. Air quality, doors, lighting, walls, floors, paint, windows, all of that. During COVID, it has been a real challenge. We set up tents for testing. We had to close down a lot of entrance points and exit points around the facilities. That was a big challenge to help set up screening stations in the lobbies. I have great respect for all of my staff, but two individuals are second to none, and one of them is AJ Singh.
I'm a senior stationary engineer with the Facility Service Department. By making sure all the equipment is up to par with what it needs to be doing, I feel like I'm taking care of those patients. When the pandemic first hit, we took it pretty seriously as a department because we knew we had to keep our operations running.
On the other side, I have Alex Quinn. Alex is a carpenter.
There's a million things that go into patient care. I'm just one piece of a overall machine. As far as COVID, everybody wants this barrier between them and COVID, so I become the plexiglass key.
Alex and AJ have just been real workhorses for the hospital. We're the behind the scenes folks that make a safe space for healthcare to happen.
What a snapshot of the dedication every team member brings to the ZSFG community. It's indicative of what it takes to serve here, going above and beyond to care for our community, no matter the job. From the cafeteria, to the clinic, to out in the community, ZSFG is there. Now we want to introduce you to a group of doctors and nurses from the emergency department. In December of 2020, they heard a common concern from their patients. Should they get the vaccine? Was it safe? So they came together to create a series of videos made in partnership with 510 Media, bringing compassion and understanding to those very real concerns and encouraging thousands to get the shot.
Black people and brown people in this country have historically and systematically been abused and have been victimized. I understand.
When the vaccine was initially released, I was a little hesitant. Do I believe in vaccines? Yes. Do I believe in science? Yes. Is this new? Yes. Would I like my questions answered before I proceed? Yes.
And here in the Bay Area, something like more than 50% of cases of COVID have been within the Latinx community. So when I'm in the ER, when I'm working with these patients and I see them get really sick and when I admit them to the critical care units or have to put a breathing tube in them, it's sad, it's disheartening, and it really hits really close to home because like I said, you see your family members.
There's hesitancy, but you're just, you want to know what their hesitancy is.
Yeah.
And we are seeing a lot of videos and education, but it's just so much, lots of technical terms that sometimes even for me, I'm like overwhelmed. I'm like, oh my God, just say what it's gonna do. Just say how it's gonna act on your body. Don't start throwing out, well, the mRNA vaccine is gonna work on this chromosome, blah, blah, blah. And like, people want to
that doesn't matter.
Throw chromosomes in. No, it doesn't matter. No one's gonna listen to anything like that.
I understand the hesitancy. I think it's fine to question. I think it's best that we go, hey, why should I do this just because you're telling me? No, you have to do some of the work.
I think it is important to get vaccinated, don't get me wrong. I think everyone should be vaccinated who is healthy and capable. I also understand that people have different lived experiences. It is almost unfair in some instances to ask people to give of themselves for others when that has not been reciprocated.
I think what I would remind people of is literally hundreds of millions of people have been vaccinated. Now we're getting back to a little bit of normalcy. Now the rates of COVID are going down. And I think that just when the pandemic started and we were all kind of trying to do our part by staying inside, social distancing, I think part of doing our part is getting vaccinated and trying to get to this level of immunity so that people aren't getting sick and dying anymore.
I'm looking forward to just gatherings, people able to get together, people able to support one another physically. I also hope that we as a world have learned something from this experience, and can actually change our behaviors and change of our relationships with others and how we look at others and trust one another, look out for one another, care for one another. I really hope this just opens everyone's eyes.
It's okay for us as a community to be wary of experimentation. And I want to make sure that this is actually right for me, and it's totally understandable. The change now is that I am you and you are me, and I am doing this research for you. And I'm standing here, and I want to make sure that you understand, I got you. I'm gonna protect you. And I don't want to put anything on you that I wouldn't put on myself.
Hi, I'm Mayor London Breed. Zuckerberg San Francisco General Hospital and Trauma Center is one of the best healthcare facilities in the country. This hospital has been a leader during the COVID pandemic, the AIDS and HIV crisis, and in addressing health issues, including mental health and substance use disorder. That legacy is shaped by the doctors, the nurses, and public health officials who call the General home. Tonight, we honor 3 individuals who have gone above and beyond to care for our city. But these 3 honorees are able to do this work because of the incredible teams that they work with every single day. That is what the spirit of San Francisco is about, coming together, embracing our diversity, and working towards a common goal of a healthy and safe city. San Francisco General is changing what it means to provide health care for a community by meeting people where they are. Whether it is creating new ways to provide checkups and clinical health services, or providing people and families with groceries and supplies as part of their in-person doctor visits, or spearheading innovative harm reduction and treatment programs for people struggling with substance use and health disorders. I am inspired every day by how the hundreds of people at San Francisco General come to work and change lives. That dedication is a part of the heart of our city. I cannot wait to see the newest additions to the Hearts in San Francisco collection out in our neighborhoods, sharing the message of compassion and hope. Thank you to everyone for joining us this evening in support of San Francisco General Hospital.
Thank you, Mayor London Breed. Continuing in our celebration of unsung heroes at ZSFG, let's meet the medical surgical nurses and Sojourn chaplaincy.
It's very special to be a nurse here at ZSFG. The nurses have the honor and the privilege to be with people at their worst when they're ill. We treat everyone as if they're our family. During this whole time, while we had COVID, we also ran a hospital that did elective surgeries. We have primary care, specialty care, other illnesses that we treated, and we continue to give outstanding care to all our patients. Chinello demonstrates the art of nursing.
I'm a registered nurse at San Francisco General Hospital. I work at H66 and 68, which is our COVID unit. We nurses spend the most time with the patient. So in addition to being the nurse, you are also the emotional support, not just for the patients, but for the families who could not see this patient. We're a bunch of nurses who thrive on being the best that we can be, so that we can provide the best care that we can for the patient.
Chinello is an amazing example, but we have thousands, maybe 2,000 Chinellos here in their own special way, because people choose to work in this amazing, healing, caring environment.
Our work here at the General is focused on providing spiritual and emotional support for the patients, their families, and the staff here at the hospital. Part of what we do as chaplains is help patients and family members connect with the inner resources that they have that will help them get through the hard times that they're facing. It's just been really beautiful to witness Chaplain Floyd leading poems at huddles and bringing reflections. Chaplain Monica has a background in singing and has been offering song for patients and families.
When the opportunity presented itself to come to SF General, I jumped on it, and I was elated that I was chosen to be one of the ones to come and serve in such a crucial time.
The pandemic has challenged us all in profound ways, and the role that we've stepped into more and more as spiritual care providers is to help hold staff in the work that they're doing.
It requires us to really find a grounding place to be present with those who we are called to serve.
I work with an incredible group of folks in the spiritual care department, and I will say that the chaplains here have been real heroes.
We are a place of compassion, a place of hope, and a place of safety.
And how important that safe spaces like this exist. Not only places to heal our bodies, but to heal our hearts and minds as well. It's because of the hearts of our caregivers that our city's public hospital can care for so many. And it's because of all of you that ZSFG is able to keep its doors open to everyone in need. As a direct result of your philanthropic support, this incredible hospital is able to expand critical programs, purchase the latest technology and equipment, and continually improve patient care. So we're asking you right now to commit to equity and access in healthcare by making a donation. To the right of your screen, you'll see a red button asking you to give. I know the stories so far tonight have inspired you to invest in public health. And now, all you need to do is tap that button. A generous thanks to our generous sponsors, the California Healthcare Foundation in particular, whose gift is going to be doubling everything that is donated tonight, doubling it up to $100,000. So far this evening, we're just over halfway to our goal, so please consider making a donation right now to help us fulfill the promise of this amazing matching challenge. Now, let's step back a moment. The foundation was started by a group of volunteers who cared deeply for our public hospital. None more so than two names you know well, Ellen Newman and Nancy Bechtel, co-founders of the Hearts in San Francisco project. Our entire community felt the loss of Nancy Bechtel this year. We are so honored that her friends and family are here with us this evening to celebrate her legacy.
Remembering Tony Bennett, and I left my heart in San Francisco, and remembering the cows in Chicago, I thought we could do hearts like the cows.
We had just been at the Chicago Marathon, and there were cows all over the streets. And she said, I want to do the same thing with hearts in San Francisco. Oh, when she said, how about that idea? I said, what a fantastic idea.
And that's how it began. What it's done for the general gives real world impact. The fact that there's a new hospital, everyone at the hospital says would not have happened without the Hearts Project.
Zuckerberg San Francisco General is just, it's key to San Francisco, to the region.
The Hearts Project put it on the map.
To the artists, it meant really a lot. We didn't have to sell them. I don't remember anybody turning us down. Ellen and I were made out of the same cloth, and if we ran into an obstacle, we would just figure out some way around it. So it ended up taking 2 full years.
Rita Barella, Patrick Smith, Nancy Bechtel, and Ellen, the committee of 4.
We had no money.
Nancy has a way of asking for money like this.
I love raising money for something that I really believe in.
The Chronicle supported this project from day one. We were on the front page in the beginning, and then inside the paper every day, every day. Gavin Newsom was 100% behind the project.
Without Gavin's support, we would probably not have been able to launch it. Gavin said, we want to have the hearts out there. We want to do everything for the general.
Our goal was $1 million, and we exceeded it.
We ended out, by the way, netting $3 million the first year. I hope that Hearts in San Francisco will continue forever, and that it will inspire people to take it to even greater heights, heights that Ellen and I could never even have imagined.
Join me wherever you are right now in sharing a moment of our hearts together. The Hearts in San Francisco sculptures are iconic throughout our city. This year we added 20 new sculptures to the nearly 500 hearts that have raised critical funds for ZSFG over the past 18 years. We're going to take a look now at this year's hearts, currently on display at the San Francisco Ferry Building. Keep an eye out for a special heart that depicts a circus. Did you find the heart with the Corona Circus? That was by our youngest artist ever, an impressive third grader, Readon Desai. These one-of-a-kind heart sculptures are available in our silent auction, which you can see to the right of your screen. The auction will remain open until Valentine's Day. All proceeds benefit innovative and compassionate care at ZSFG. And a special announcement, our early bird mini heart raffle winner is Melissa Chadwick Dunn. Melissa, thanks for your support. Many of you know our beloved Heroes and Hearts Awards, and we're thrilled to bring them back this year. Here to speak to the vital importance of a strong public hospital is Speaker Nancy Pelosi.
Good evening. As Speaker of the House and proud representative of San Francisco, it is my official and personal honor to bring warm greetings to the San Francisco General Hospital Foundation's Hearts and SF Awards. Thank you to the relentless Kim Meredith, CEO of the foundation, for organizing this wonderful celebration, for your constant support for the hospital. And let us salute Dr. Susan Ehrlich for your life-saving leadership, ensuring the General continues to stand as a beacon of health and hope for our Bay Area community. For 2 long years, San Francisco's healthcare heroes have served on the front lines of our battle against the COVID pandemic. With extraordinary courage and in the face of great personal risk, you have gone above and beyond your call of duty, helping to keep our families healthy and saving countless precious lives. Indeed, it is a testament to your valor and resilience that our city has been able to muster one of the strongest responses to this crisis in the nation. And despite the challenges posed by the pandemic, you found innovative new ways to continue to deliver urgently needed care in our communities. To support your important work and help crush this vicious virus, the Congress proudly enacted the historic American Rescue Plan last year. This life-saving legislation delivered more resources to care providers in the Bay Area and beyond, and got hundreds of millions of shots in arms. As we continue our fight against the pandemic, tonight our Bay Area community comes together to honor all of the hardworking healthcare heroes at the General who are so deeply deserving of these special awards. And in bestowing these awards upon you, our community offers a token of our endless gratitude for your valiant service. Thank you again for all that you do for our families, and best wishes for a wonderful celebration.
Thank you, Speaker Pelosi. Now, let's welcome Elizabeth Minnick, chair of this year's event. Elizabeth, thank you for your time and dedication to Hearts in SF.
Hello, I'm Elizabeth Minnick, proud San Francisco General Hospital Foundation board member and chair of this year's Hearts in SF 2022. I'm also the local market executive for Bank of America, and on behalf of our 5,000 Bay Area teammates, we are so honored that you were able to join us here tonight. At Bank of America, we connect individuals, families, and communities to resources that make financial lives better. We also know that strong, vibrant communities require equitable solutions for all. That's why Bank of America has made a 5-year, $1.25 billion commitment to advance racial equality and economic opportunity for communities of color in the areas of affordable housing, supporting small business, job reskilling, and health. And we've partnered with the San Francisco General Hospital Foundation and ZSFG because of our shared focus on health equity. Today, 75% of ZSFG patients identify as Latinx, Black, or AAPI, and 70% are either uninsured or underinsured. We believe that whole person health goes beyond medicine, goes beyond physical well-being, and goes beyond one's mental condition. On behalf of Bank of America, we are grateful for your attendance and your continued support of the hospital. Despite the world's challenges, healthcare happened at ZSFG, and with your support, it always will.
Heroes and Hearts Awards have a long history of celebrating the people that make ZSFG one of the top public hospitals in the country. Let's meet this year's awardees. Dr. Malini Singh is professor of emergency medicine and vice chair of the Department of Emergency Medicine at Zuckerberg San Francisco General Hospital. Dr. Singh is being recognized for connecting with patients and combating medical misinformation. She helped establish the We Are You project that addresses COVID-19 vaccine hesitancy. Here's Dr. Malini Singh.
I am so honored to receive this award. It celebrates a part of me that I cherish so much about being a provider, and that's patient education. I have found the education I've been able to do with patients, particularly during this pandemic, being my most powerful tool for saving lives. I want to dedicate this award to my colleagues who took part in this video, the ZSFG Foundation, and 510 Media for giving us the platform for sharing our message to reach to the communities that have been most impacted by this pandemic. Without these tools, we couldn't do what we needed to truly do and feel like we had to do in our hearts. I'm an emergency medicine physician. Myself and my colleagues were on the front lines from the beginning of COVID. We still took care of people, we still saved lives. The only difference between lockdown and pre-lockdown was now we were wearing N95s. We saw the disparities COVID had, especially on our brown and Black communities, on their health impacts. And we saw it even more so in their uptake of the COVID vaccine, mostly due to mistrust and distrust of the vaccines. So I had an idea. My idea was, why don't we have a public education campaign to reach out to these communities that are most vulnerable to help change the narrative around this distrust and mistrust the communities had towards the vaccine. I reached out to my ED colleagues and I had a resounding yes that we needed to do this and we wanted to do this. I then went to the foundation to ask for a platform to share our message. I again received a resounding yes. It was this alignment between my healthcare providers, the foundation, and the media company that helped really give us the voice and the platform to share our message to the communities that are most at risk, to let them know we are here with you. We are you. If COVID taught us anything, is that we are all so interconnected, and the health of one group can impact the health of another. We need consistent messaging by public health leadership to help us all row in the same direction. We have been so fortunate to have such strong public health leadership voices with us in San Francisco during the pandemic that helped us bend the curve and be the role model city we have been.
Dr. Jeff Manley is the Chief of Neurosurgery at Zuckerberg San Francisco General Hospital. He is also Professor and Vice Chairman of Neurological Surgery at University of California, San Francisco. Dr. Manley has been leading the charge to create the first rapid handheld traumatic brain injury blood test, widely considered to be the next step in the evolution of diagnosing and treating traumatic brain injuries. Here's Dr. Jeff Manley.
While I'm personally honored and humbled to accept this award, I would be remiss without saying that I'm accepting this truly on behalf of everyone on the neurotrauma team. Each and every individual has contributed to really provide the highest level of care to every citizen of San Francisco who we take care of here at Zuckerberg San Francisco General Hospital. Over the last 10 years, we've been working on new diagnostic tests for traumatic brain injury. With a single drop of blood, we can now rapidly diagnose a brain injury in the emergency department, in an ambulance, or on the sidelines. This is not only going to revolutionize traumatic brain injury care for those in San Francisco, but for patients around the world. Many people in San Francisco are aware that we're the safety net hospital for the city, but what many people don't know is that in fact we're the only level 1 trauma center in San Francisco. You may not know me, you've maybe never been treated by me, but tonight, tomorrow, the next day, any one of us on the trauma team could be your doctor. This is why you need to invest in San Francisco General Hospital. We are not only the safety net for the city, but we are the only level 1 trauma center. And we provide care to everyone in this city, whether you're the most wealthy person in San Francisco or whether you're homeless. We deliver the same high level of care to everyone in this city.
Dr. Neil Poe is the Chief of Medicine at Zuckerberg San Francisco General Hospital, a Constance B. Wofsky Distinguished Professor, and Vice Chair of Medicine at the University of California, San Francisco. Dr. Poe is being honored tonight for his work to advance the health of patients and populations affected by kidney disease. Here now is Dr. Neil Poe.
I want to express my heartfelt gratitude for this award. I appreciate the recognition that my colleagues have given to me. Here at ZSFG, we save lives one at a time in our emergency room, in our clinics, in our hospital units, in intensive care, and in our operating rooms. But we also save lives by the work that we do for the health of the public and for health equity. We prevent the ailments and diseases for which San Francisco citizens seek our care regardless of their position in society. So it's important that we invest in public health so that we're ready for whatever comes our way. Climate change, an earthquake, or a pandemic. I've had a long commitment to addressing health disparities and racism in medical care. In kidney disease, I've worked to understand the barriers to specialty care and life-saving and enhancing therapies for patients with kidney disease. I recently co-chaired a national task force that fashioned a way to remove race from the estimation of kidney disease. We did this with not only our values, but looking at evidence that would help save patients' lives. So thank you for this award. My work is not done. This award will make me work even harder to achieve health equity for all.
It is straight up inspiring to see the immense talent and dedication that exists at SF General. These heroes show up day in and day out with a passion for serving those most in need, and we're incredibly grateful they're in our corner. Let's check in on our challenge match this evening. I am thrilled to announce that we are 70% of the way there. Thank you to Susan Ehrlich, our hospital CEO, John Bell, our board president, Alex and Kevin Marchetti, and Erica and Jeff Lawson for donating to the challenge match. And thank you board members Simone Balch, Howard Chi, Bob Tandler, Janice McKenzie, Alex Rosenblatt, and Elizabeth Minnick for chairing this year's event. After hearing from so many dedicated team members at ZSFG, it's only fitting that we now hear from Dr. Susan Ehrlich, CEO of Zuckerberg San Francisco General Hospital.
Thank you so very much. We could never do the work we do at ZSFG without your support, especially during this pandemic. Without our new acute care hospital, without our new emergency department, our intensive care unit, our medical surgical unit, we would never have been able to care for the community as safely and as expertly as we did without this new hospital and without your support. Not only does the hospital keep us all safe and allow us to deliver the best possible care, but it recognizes our staff, it recognizes our heroes for the work that they do every day. Thank you.
Thank you, Dr. Ehrlich. We're honored to invite Dr. Priscilla Chan and Foundation CEO Kim Meredith to join us to discuss the vital role a strong public hospital plays in making San Francisco a community that can thrive.
Well, thank you, Priya, for that introduction, and welcome, Priscilla. Thank you for joining us tonight. It is great to see you.
It is a pleasure to see you too.
Well, thank you. Well, I'd love to start with my first question. I just would very much welcome hearing about your personal journey and what attracted you into medicine, and then how did you end up at UCSF and ZSFG?
For me, medicine was the end of a journey of both loving science, loving biology, being enthralled by learning about the science of how the body works, but more importantly, it was a way to deeply care for others. As a kid, I always knew I loved helping others however I could, and I always knew, I guess I always knew in the future I'd be a pediatrician because I preferred kids to adults. It was a way to be most of service to others in my community. When I was in college, I ran an after-school program, and I was like, okay, I'm in this role, I can support these kids in this community. And then I became a teacher, and then I was like, okay, what is the next best way for me to be of service to others? And it was becoming a physician. I think if we back up all the way through all those different lenses, I remember something that's deeply core to my identity is that I'm the child of refugees. And my parents and my grandparents were boat people, and I like to think that I inherited either the DNA or the epigenetic modification that made a group of people audacious and optimistic enough to know that there was something better in the world for them and their future. And I want to be part of a group of people that all felt that audacious. And I have to say, at the General, people feel that way. People just have this uncanny belief if they're just optimists. Things are not great at the moment. Usually you're not unless you're in labor and delivery, being at the hospital is not one of your greatest days. But especially a lot of the cases at the General. But the heroes, the people who are endlessly, day after day, committed and optimistic, are the people I want to be around, and I feel inspired to spend my time with. And so when I got there as a medical student, I was like, I found my people. We all, we all share that gene, that methylated site that makes us passionate and optimistic that we can make someone's life better, a little bit better that day.
That's such an inspiring personal journey for you. And I love the fact that you say, this gene of compassion, if you will, but also audaciousness. So when you think about taking your personal passion and kind of pulling that out with a broader view, how did your time at ZSFG inform your thinking related to healthcare in the United States, and then how that later has informed your philanthropy?
One of the core lessons that I learned at the General is that it's not an isolated, medical breakthrough or technical breakthrough that is going to be the answer to a person's health issue. Sometimes it is, but more often than not, it's a complex constellation of things that make a good health outcome possible. And that's where you have to understand all the factors in a patient's life that bring them to you at this very moment. And whether it's the public transit system, the public health system, the way our workforce is structured, translator services, none of those things are directly related to the delivery of medicine as we traditionally think about it. But at the General, all those things are top of mind, and you have to understand the interplay of those factors when you think about caring for a patient. And I remember living that firsthand myself. When I see the kid at the General who's translating but shouldn't be, that's me. I remember doing that. Or an elderly person clutching a piece of paper that they think has the answer to sort of where they need to go or be, and they speak no English. Those are my grandparents. And honestly, people running late, running multiple jobs. They're my aunties and uncles and parents. And so I remember living that. And at the General, I had the honor of practicing medicine and learning from those who understood this complex interplay in the delivery of medicine. I carry that lesson with me leading CZI, that you have to collaborate, you have to understand the true nature of a problem and the barriers that come in a lot of individuals' everyday lives. And that's staying close to the work, making sure you understand the true nature of the problem and that you're solving the right problems. You have to get out of the lens of the ivory tower solution if you really want to have impact in the community, in society.
Thank you for that, Priscilla. I love how you're describing staying proximate to the problem. And as we stay proximate to the problem, it requires having empathy from very different lenses, as you've described. And so I look at you and I see you as a leader in medicine. I know you're also a leader in education. You're a philanthropist and you're a mother. And so this past year during the pandemic has certainly acutely put forth the issues related to health equity and access to care, just as you were describing. So as those issues have been illuminated over the past 2 years of the pandemic, has that shifted or restructured how you think about your work?
The lesson that we've taken there is that it's another reminder that it's never just one technical solution in addressing a human problem. There was a time when we thought, okay, we've got to develop a vaccine against coronavirus. And amazingly, that did happen. The vaccine did get developed at breakthrough speeds. But the complexity in the often more interesting part of a problem is that we're humans. And you guys are doing the amazing work of vaccinating the communities and making sure that especially those who have the least access to healthcare have access to high quality healthcare for those who are sick with coronavirus, and also preventing infections with the vaccines. But really what it comes down to is really learning and understanding what brings people to certain viewpoints and what are the challenges people face. And honestly, to be frank, our country has not had a perfect record with minorities, people of color, the Black community, when it comes to our ability to deliver science, deliver medicine that meets their needs. And so when we've faced individuals who, question the state of the science or vaccine research, or the millions of other policies we've had to figure out in the past 2 years, I think what, as a leader and as a community member and mother and friend, the first thing that I've tried to train myself to do is to really stop and listen. We all come to this global pandemic with our own experiences, and unless we really stop and understand the perspectives of others, we're never going to get to a place where we solve problems together. And so that's a lesson that the pandemic has highlighted, and hopefully one that I hold on to with all those different hats on in the future.
I know we are going to do our best to get through this, and as we've celebrated the 5th anniversary this year of the new modern acute care hospital, your personal support has really made a difference. There's just no doubt about it, along with those from the community who have supported ZSFG. And with that in mind, there's a real opportunity to think broadly about these big problems that society is facing. And when you think about your personal support and the role of public-private partnerships, so tell me a little bit about how do you think about that partnership and the collective spirit of public-private, and what does that mean to you?
For me, I think that you have to, the two have to come together, and the big public institutions like you guys, you're a force in our community, in our city, that's always, hopefully, with the support of many, will always be there. But I think what the private groups and different philanthropies like ours can do is actually take advantage of the fact that we have speed on our side, we have flexibility, risk capital on our side, and we can help pave the way and move quickly, help fill in when things change in a community, be able to bring in new ideas, new innovations, opportunities for you guys to be able to try new things. And then with that, helping take on that risk, hopefully be able to continue to modernize what the stable infrastructure is at the hospital. And so there's sort of speed, agility, and risk tolerance versus making sure that we have a stable, high quality, state-of-the-art public institution that is the bedrock of public health in San Francisco.
Oh my goodness, that is so well put. And I just love that you're talking about that combination of strategic risk capital, quality improvement, innovation, and disrupting where it needs to take place, but also just recognizing there's everyday patient care that needs to happen, and that
Absolutely.
balance.
It's the balance, and it's the understanding. For me, what I've learned working with you guys is sometimes it's an incredibly small number of dollars compared to your overall budget that can make a huge difference, because there's so much that's rightfully, needs to be earmarked for patient care and facilities and all those, the heroes that we're celebrating today and the work that they need to do. But sometimes surprisingly small in comparison to your overall budget number of dollars can really allow you guys to change and to think differently. And that's where the flexibility of the private-public partnership really is the most magical.
Thank you. It is magical, and your support has been some of that magic dust that has certainly found its way to us, so we are fortunate. My final question to you really is about this spirit of optimism. So what makes you optimistic as you look ahead? And have there been any silver linings? You referenced that earlier this evening, that you've learned from the pandemic as we look ahead to 2022 and beyond.
There are so many powerful moments of people coming together during these past 2 years when everyone's exhausted, tired, scared, and I just think you have to believe in the goodness of humanity and the collective power we all bring together, and people craving the ability to connect again. And so, I look at all those moments in light of what's happened. That's powerful. And if we can really remember that and hold that spirit when the world is less heavy, I'm so optimistic about what can happen. And I think we've all understood more how critical basic science research is, how awe-inspiring it is, how critical the public health system is. None of us will ever take a nurse, a technician, a physician for granted ever again after seeing what they have been willing to do for us day after day for the past 2 years. The depths of understanding and the gratitude that we hold in our hearts for these groups, that has to change us as a society, and it will, teach us so many more lessons along the way that we haven't uncovered yet. So that's what I think the silver lining has to be. Oh gosh, and don't get me started, teachers. I don't think a single parent in the world will ever take a teacher for granted again. it's just been so clear, the mark that they make on our children's lives.
Well, clearly your medical leadership and your education leadership come forth in your spirit of optimism, and with that is such a wonderful, inspirational way for us to conclude our evening and conversation, Priscilla. So thank you for joining me this evening, and thank you for your support. Truly, the investment that you and Mark made to ZSFG was critical this year. And importantly, the gift that the two of you made kept us going during this pandemic, and healthcare continued to happen. So thank you, and we greatly appreciate your support, your optimism, and your vision of the future.
I'm so grateful for the work that you're doing in empowering us to support all the heroes at the hospital. So thank you to you.
Priya, back to you.
Kim, thank you. Dr. Chan's commitment to public health was strengthened through her training at San Francisco General. That's why, tonight, we honored Dr. Sue Carlisle, who played such a vital role in the training of thousands of doctors at ZSFG. Dr. Carlisle is retiring this year as the Vice Dean of the UCSF School of Medicine at ZSFG after nearly 40 years. Let's learn more now about her legacy.
I have known Sue Carlisle now for at least 20 years, all of my time on the board. I have known her. I'm just so happy to honor her. She is a multi-layered person, and when I first knew her, what I saw was the doctor uniform, and then I began to see the negotiator part, and finally I saw the adventurer. She goes on wild trips around the world. She is wise, she is smart, she's been a wonderful collaborator with the foundation and a link between the hospital and UCSF and the foundation. I've loved working with her and knowing her as a friend, and I know that the foundation will deeply miss her, and I hope as a friend I won't have to.
These stories of inspiration, compassion, and love have filled my heart, and I'm gonna guess they've filled yours too. I am certainly not ready to go, but we are wrapping up our main program tonight. Over its nearly 150-year history, ZSFG has been at the center of public health for our entire community, which would not have been possible without generations of heroes like those we've celebrated this evening. If you're as moved as I am after such a heartfelt evening, I hope you will join the nearly 300 supporters who have already donated tonight by making your gift right now to support a public hospital we can all be proud to call our own. No matter how big or how small, your investment in public health will help us meet that $100,000 goal and have an impact for years to come. And while I am signing off from the iconic ballpark at Oracle Park, please stick around for an acoustic set from artist Ron Artiste II and testimonials from patients, friends, and colleagues. Until next year, hopefully in person again under the big tent, thank you for joining the San Francisco General Hospital Foundation for Hearts in SF 2022.
Hey, aloha everybody, I'm Ron Artiste II, and I'm really honored to be here supporting Hearts in San Francisco as part of the annual fundraiser for the San Francisco General Hospital Foundation. I want to thank you all so much for participating and being a part in all this. I'm going to be sharing some music, and the first song I'll be sharing today is called In My Heart. I hope you enjoy it. In my heart, the sun is always shining. Worries are distant.
worlds away. It's in my heart. We're all just little children, dancing and singing with tears of joy. You say you're different, but I cannot agree. 'Cause this whole world, one day we'll go drifting out to sea. Oh yeah. And in my heart, the sun is always shining, and worries are distant, worlds away. Some days you'll feel down, and that's alright, 'cause that's why we're here, to lift you from the ground. In my heart, yeah, we're all just little children, and worries are distant, worlds, worlds, worlds away, yeah.
Yeah, you guys, man. Song's called In My Heart. We can lift each other up and pull each other through so many things together.
Hello, my name is Samantha, and I am a former patient of Dr. Manley. On December 21st, 2012, I had a freak accident and I was admitted to the only Trauma 1 hospital in the entirety of San Francisco, SF General. I was admitted with a traumatic brain injury as a 10-year-old, and Dr. Manley operated on me. He said that the location of my injury is a potentially life-ending injury because it was so close to the vein that drains all the blood from your brain. I was told that I was struck by a street sign while I was walking on the sidewalk with my brother and my dad. I had learned that my frontal skull was shattered upon impact and that Dr. Manley had to operate on me by putting my skull pieces back together with titanium plates. I also learned that the eye socket of my left eye was completely shattered and that he had to completely reconstruct that as well. He has given me the ability to live life to the fullest, as I like to say, with caution. I returned to dance. I was watched over carefully. In addition, I'm able to ride roller coasters. I do headstands on the beach, and I am able to go through airport security without setting off the metal detector because Dr. Manley put titanium plates. I also had to say I was extremely worried about my physical appearance because this scar ran from the top of my head down my forehead. And when I first saw myself in the mirror after operation, I was completely unrecognizable. And today, few people can even see the scar, and nobody is able to see the slight bump in my skull where a titanium plate sits, connecting the fragment of my skull to my intact skull. And luckily, my scar right at the hairline gives me a perfect part. So every time I part my hair, I get a perfect center part every time. And I have Dr. Manley to thank for not only saving my life, but also giving me a perfect center part every time. I would like to thank Dr. Manley for faithfully being on call December 21st of 2012, for operating on me and giving me the ability to live life to the fullest with caution. I would also like to thank Kim Meredith, and Helene Sims for giving me the opportunity to speak at Dr. Manley's tribute. Thank you, Dr. Manley, and congratulations.
I'm gonna share one more song with you guys here. This one's called "No Wait" because it's inevitable that we run through all sorts of things in our lives that seem to set us back, or hardships, or just unexpected turns. And it's important to remember that the best way to rise is to lift someone up.
Best way to rise is to go lift somebody up underneath the weight of the world, but don't go giving up. Oh, oh, oh. I keep singing songs and hope that I would see you smile again. Yeah, yeah. We've lost a lot, but we'll get through a little more. Don't be afraid, the pain can't hurt you anymore. Oh, oh, oh. I keep singing songs and hope that I would see you smile again. Yeah, yeah. And no wait's gonna keep us down. No wait's gonna tear us down. No wait's gonna stop our love. And no wait's gonna tear us down. No wait's gonna take the crown. No wait, no wait, no wait. You know the power of love, how much it's gonna change. How can we come along if we remain the same? I keep singing songs and hope that I would see you smile again. Yeah, yeah. And no wait's gonna keep us down. No wait's gonna break us down. No wait's gonna stop our love. No wait's gonna tear us down. No wait's gonna take the crown. No wait, no wait, no wait. So no wait, no wait, no wait.
Aloha. Thank you guys so much for spending time with me and for supporting Hearts in San Francisco and connecting online and just really having a heart for your community. I want to thank you all so much, man.
The Zuckerberg San Francisco General Hospital and Trauma Center has been a part of San Francisco's history for over 150 years, responding to the health crises needs of the city's most vulnerable. And for 4 decades, at the very center of it all has been Sue Carlisle. With her unflagging advocacy on behalf of ZSFG and her work in strengthening the important relationship with the San Francisco Department of Public Health, Sue has proven herself to be a hero in the success of the institution. She has been an advocate at the forefront of some of the most important issues of faculty life and wellness, a champion of women's rights, working to ensure the recruitment, promotion, and retention of women at UCSF. And she has served on countless committees in support of faculty work-life balance. Sue, you have been a hero for this city. Through times of change and times of crisis, your counsel has been priceless. To me and other leaders, both in the city and at UCSF. It has been a great pleasure of my career to know you, and it has been an honor to work with you. Thank you, Sue, for all that you've done.
The core of what makes CSFG so special is the partnership between the City and County of San Francisco, the Department of Public Health, and the University of California, San Francisco. These groups bring together our staff who contribute their expertise, their passion, and their compassion in the areas of clinical service, education, and research. Dr. Sue Carlisle has been at ZSFG for almost 40 years. She's been the leader with me during that time. And she is a wise, she's a compassionate, she's a very strategic leader. And through her leadership, the partnership has truly grown and matured. I'm going to miss Sue a lot when she leaves. And she and her team have really built an incredible foundation for all that is to come and all the great things that we'll continue to do together over time. Thank you, Sue.
In a world where it's all about what you have, not who you are, it doesn't count anymore. So you look at the world and you feel like it's fading, because no one has time for life. But oh, you'll figure it out. Just look all around you. You don't need no doubt. So life's what you need. If you don't believe me, look in the eyes of a baby. Ooh, yeah. Eyes of a child. Sometimes you think you'll never get through it. La 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 la. Sometimes you think it's all in my mind. Sometimes it's just a moment where it all will disappear. But paradise is more than just a place. So wait on this moment. Wait on this day too. Be yours. Be yours. Be yours, be yours, be yours, be yours. In today's day.
Mahalo, everybody. Thank you so much for spending time, and love you. God bless.
Hi, my name's Gina Shaw. I play drums in a band called the Go-Go's. And I am here today to thank every doctor, every nurse in the community that works so hard to take care of all of us. I actually fell and fractured my ribs, and I was taken to Zuckerberg General Hospital and got excellent treatment there. I love this town, and I'm so grateful to have this wonderful hospital, San Francisco General, that takes care of all of us. And I thank you all so much for helping to make us a healthy community. How lucky are we to have these wonderful doctors and nurses available to help us all stay healthy?